Hi, I'm Sean Elliott. Thank you for inviting us to report the Optilume drug-coated balloon for recurrent anterior urethral strictures, 3-year results from the Robust 1 study. I'm presenting on behalf of the authors listed here. This is a follow-up report. We've previously reported the 2- and 1-year results, and now we report the 3-year results. The Optilume drug-coated balloon is a paclitaxel-coated balloon that is in study now for FDA approval to be used to treat anterior urethral strictures. It's been introduced because DVIU and dilation, although they're very common, have poor long-term success. And there's been some promise with mitomycin C as a anti-fibroblast medication at the time of DVIU or dilation, but those results have been inconsistent and user dependent. We've reported that with the Optilume drug-coated balloon, we have 70% 1-year anatomic success by cystoscopy and 70% 2-year functional success by IPSS. And herein we report our 3-year functional success results. Methods listed here. This is a single-arm prospective open-label study. The eligibility criteria listed here, but basically adult men with a single stricture less than or equal to 2 centimeters in length. All men got a pre-dilation or DVIU before the Optilume was inserted. It comes in 24 and 30 French sizes and 3 centimeters long. They all got a catheter for 3 days afterwards, cystoscopy at 6 and 12 months, and then IPSS every 3 months for the first year and then annually through year 5. We've previously reported excellent safety results, and herein report functional success as measured by an IPSS improvement in their total score of greater than or equal to 50% in the absence of retreatment. The baseline characteristics of the study population are described here. As I said, generally short strictures, less than 1 centimeter was the mean. You can see that the pre-treatment was usually with an uncoated balloon, occasionally uncoated balloon plus a DVIU. And you can see that the number of previous endoscopic treatments was most commonly 1, and then some men had 2, 3, or 4. Our primary efficacy endpoint, or our responder rate, as I mentioned before, is greater than or equal to 50% improvement without a repeat intervention, greater than or 50% improvement in IPSS. And you can see here that at 3 years, we have a 67% responder rate, and 77% of men are free from repeat intervention. How about other outcomes? We can look at the cohort mean IPSS over time, and it has declined from a baseline of about 25 down to 5.5 at 36 months. And I think you can appreciate from this graphic that the mean IPSS is not rising over time. Similarly, the Qmax has remained good. It went from a Qmax at baseline of 5 up to a Qmax of 22 immediately after the study. There has been some steady decline in the Qmax, but at 3 years, it's still very good at 15. Other 3-year outcomes, the IPSS quality of life improved from a baseline score of almost 5 down to something less than 1. IIEF remains unchanged, showing that this has no negative impact on erectile function. The post-void residual urine volume measurement has improved from 141 pre-op to 50 cc's post-op. So in conclusion, men with recurrent bulbar urethral strictures treated with the Optilume paclitaxel-coated balloon exhibited significant improvement in symptomatic and functional outcomes through 3 years post-treatment, with a 67% functional success at 3 years. Thank you.